Hi U9, welcome to YouTube. The RAET, or Radioactive Experience Team, brings you an episode on radioisotope iodine 131, or commonly known as radioactive iodine. For starters, what is a radioisotope? Well, a radioisotope can scientifically be defined as an array of atoms with an unstable combination of neutrons and protons, that of which you've already learnt about in Year 9 chemistry. Radioisotopes, including radioactive iodine, are a significant part and essential to the aspects of radiopharmaceuticals, especially in the field of nuclear medicine. Radioactive iodine is a radioactive chemical element formed from nuclear uranium atoms and emits short-range beta rays. However, this is not always the case. Radioactive iodine has a half-life of about 8 days, which it then starts to actively decay into xenon 131, which now emits low-range rays known as gamma rays. This requires iodine 131's nucleus to decay into a neutron and electron, which is then emitted from the atom as a beta particle. Now the isotope has the same mass number 131, but a new atomic number, which was 53, now 54, commonly known and identified as xenon. Iodine 131 is used for diagnostic and treatment purposes. Iodine 131 can be used to treat thyroid cancer, hypothyroidism, and Graves' disease. For this disease to be identified, the patient takes a low dosage of iodine tracer. The diagnostic image requires iodine to accumulate in the thyroid gland, proving an overactive thyroid by its abnormal size on the screen. For therapeutic purposes, the patient consumes a large dose of iodine 131 isotope in the hopes it will destroy diseased cancerous tissues and the thyroid to stop producing abnormal amounts of hormones. The beta radiation kills about 90% of the cancerous gland, and the gamma rays the remaining 10%. There are some amazing benefits when using radioisotope iodine 131. After therapy, the thyroid will start to function properly again, and will completely destroy any harmful or dangerous thyroid tissue or any other cancerous tissue in the body post-thyroid removal, saving and helping lives. There are also minimal side effects. Like most nuclear medicinal therapy, there is always a risk of some problems occurring. The dosage you are given is calculated by height, body weight, and your condition, but this is still an estimate, meaning greater risks of being prescribed a higher or lower dosage than needed, ultimately damaging the thyroid further, not functioning normally as expected after treatment. In terms, they can be completely cured of hyperthyroidism, but develop hypothyroidism. Patients may feel nauseous and will need lifelong monitoring after treatment. After treatment, the patients will need to be kept in isolation to ensure no radiation exposure to anyone else. Female patients are also told to be precautionary for 6 months after treatment to falling pregnant, as the radioactive materials can cause birth defects. However complicated or intimidating the issues of iodine 131 treatment sounds, these problems are definitely outweighed by the benefits. Again, any of the problems which radioiodine poses to the patient are easily treated and deteriorate rapidly throughout time. For example, the risk of hypothyroidism can be cured by taking a natural synthetic pill prescribed by a specialist. All other procedures of the patient after treatment are closely monitored. Radioactive iodine therapy can save lives, deeming it extremely valuable to the world of nuclear science.